So this is about the Fawzia sheet 1. The question is, pressure within the pleural space is negative with respect to atmosphere except in which of the following conditions? Always the intrapleural pressure. So this is the pleural cavity, this is the lungs and this is pleural cavity. The cavity has got always negative pressure except when you are doing Fawzia maneuver. What is Fawzia maneuver? So even in expiration, even in inspiration, it is always negative except in Fawzia maneuver. It refers to the forced expiration against the closed vocal cord. So whenever someone trying to increase the pressure in the thorax, that is under such circumstances, intrapleural pressure can become positive 60 to 70 millimeter of Hg. So generally it is negative except in Fawzia maneuver. Next question is, 30 years old alcoholic man present with acute upper abdominal pain and vomiting. He is admitted to ICU with diagnosis of acute pancreatitis. 48 hours later he develops peripheral paresthesia and carpopedal spasm. So pancreatitis, carpopedal spasm, there is always hypocalcemic tetany. This is hypocalcemia. So this is a Ranson's criteria. To understand what happens in pancreatitis, the important thing is, one is age, second is leukocyte count. This is infection is there, age is above 55, leukocyte count at the time of admission, if it is more than 16, blood glucose is raised. Pancreatitis, blood sugar is raised. Leukocyte, blood glucose, age, serum LDH and AST. When they are high, so at the time of admission. After admission, after 48 hours, if the patient's hematocrit, if it increases, if blood urea nitrogen, if it is more than 8, serum calcium, hypocalcemia less than 8, partial pressure of oxygen less than 60 millimeter of Hg, base deficit means there is acidosis, and sequestration of fluid more than 6 liters. So after 48 hours, if it is this, the patient is having the score mortality more than, so each has got the criteria. So score less than 3, mortality is 0.3%. If score is more than 3, 11%. If score goes above 6, 40% mortality. This is acute pancreatitis, Ranson's criteria. So at the time of admission and at the time of after 48 hours, age, LDH, glucose, serum LDH, leukocyte, AST. Then after 48 hours, hematocrit. The important is sequestration of fluid. There is a lot of fluid is lost, third space loss, and base deficit, lactic acidosis, metabolic acidosis, calcium is hypocalcemia. That's why hypocalcemia is there. Next question is, 50-year-old woman attends to GP due to change in appearance. She finds difficult removing her rings. So rings, difficult, shoes, photographs, reveals facial appearance, visual feedback, direct visualization. Which of the following defects is most likely? This is acromegaly. So when there were increase in anterior pituitary hormones, size is increased. So that leads to compression at the optic chiasma, lead to bitemporal hemianopia. So this is acromegaly. What is there? Prothagandism means the chin is increased in size. Bones, hirsutism is there. Enlarged hands. So this you can see the hands. So this is acromegaly. So when this pituitary gland is increasing, it is causing the compression at the optic chiasma. So whenever there is compression at this level, the optic, this on the medial side, there is crossing. So this is bitemporal. This side is lost, and it is also called as tunneled vision. So pituitary adenoma, optic chiasma is above the diaphragmatic villi, most common sign of pituitary tumor, extended beyond the confines of sella turcica, visual seed, gross pressures, optic chiasma, bitemporal hemianopia. Anopia, it is not anosmia, anopia, which is produced by the tumor pressing the crossing of the central fibers. Next question is, for a 24-year-old man falls off the bike, fracturing one arm, both femur, rupturing spleen, requires surgery, 20 units of blood, massive blood transfusion, 24 hours later, 350 ml urine, blood pressure is 90/50, low skin turgor. Which of the following best describe the changes in renin-angiotensin initiated at juxtaglomerular apparatus? So hypovolemia, renin is suddenly secreted, increase renin secretion. So it has to be increase renin, increase angiotensinogen, increase aldosterone. So this is all are increased. Aldosterone is increased. So this is important. Renin-angiotensin system. What happens? This is efferent. There is constraint. Immediately blood flow is reduced. That causes secretion of renin. So efferent vasodilatation and afferent vasoconstriction means this goes in. So this increases GFR. So proximal tubule reabsorbs more sodium, thirst, blood pressure. So angiotensin, this is converted, goes into the liver, acts on angiotensinogen to convert into angiotensin. So renin is secreted in kidney, which acts on angiotensinogen. In liver, angiotensin is converted to angiotensin 1, and 1 is converted to 2 in lungs. So here it's angiotensin enzyme, and this acts on angiotensin 2 acts on the efferent arterioles. Efferent. So afferent, which is going inside, and efferent, which is going out. So afferent is vasodilatation and efferent is vasoconstriction to increase GFR. Then proximal convoluted tubule angiotensin 2 acts on PCT, reabsorb more sodium, and it acts on aldosterone to release more aldosterone that cause retention of sodium and water. 35-year-old woman present to the emergency department with sudden attack of painful frank hematuria. What is most likely pathology? Age is 35. Second attack of painful hematuria, and most likely pathology. Painful hematuria means it can be painless is malignancy. Painful has to be some other cause. So your options is interstitial cystitis because malignancy is ruled out. Painless hematuria. So what is the picture in interstitial cystitis? Special types of cystitis. Interstitial cystitis is a chronic pelvic pain syndrome. This is persistent painful chronic cystitis. Etiology is unknown. Sometimes patient with the Hunner's ulcers. This is also Hunner's ulcer. In cystoscopy, you see this is red inflamed. Late in the stage, transmural fibrosis leading to contracted bladder. Interstitial suprapubic pain, hematuria, dysuria, frequency. This is interstitial cystitis. So next question is 60-year man presents with a short history of pain in right cheek. So right cheek and right upper teeth. Maxillary sinus infection is diagnosed. Sinus is particularly prone to infection because the opening of this is maxilla and this is sinus upper level. The position of the sinus is upper level. That's why maxillary sinus are most frequently infected sinus, because you see this is the sinus and this opening here at the top. So that's why drainage is difficult. So common infection of maxillary sinus. 75-year insulin dependent man undergoes hemicolectomy. On first post-operative day, nail by mouth. On subcutaneous insulin maintenance, IV fluid infusion with saline intravenous morphine. Why patient is confused, and so morphine is given, patient is confused. Pulse rate is 110, respiratory is 25, BP is okay, SpO2 is normal. So this depression, respiratory depression, that is leading to respiratory acidosis. Or what is this? Dependent diabetic patient is there on first day post-operative. So subcutaneous insulin, maintenance infusion with saline, intravenous morphine. Why patient is confused? So here there is nothing about opioid receptor, gamma receptor. There is hyponatremia. It is nothing but simple hypoglycemia. Diabetic patient, nil by mouth. 30-year-old women present to general clinic with 1.5 centimeter cervical lymph node along with the anterior border of sternocleidomastoid. Examination reveals routine blood emanation and excisional biopsy of the lump, and histology reports in infiltrative carcinoma and marked fibrosis and changes within the lymph node. What is most likely primary pathology? So there is infiltrative malignancy with fibrosis and cystic changes. This is secondary in the lymph node. Now there has to be some pathology. Let us see what options are given. It can be in thyroid, it can be inside the larynx, because this is anterior to splenomestoid, means these are the lymphatic drainage in the cervical group of lymph node. If thyroid is there, lymph node, it is papillary. So carcinoma of thyroid, papillary is most common. 60 to 70% is papillary, 20 to 25 is follicular, anaplastic is 10%. Age is, you can see the age is young adults, lymphatic spread, prognosis is good. Follicular, bloodstream, goes to bones, radioiodine. Anaplastic, aggressive, locally invasive, medullary, familial, and lymphatic and bloodstream, both are there. So next question is 37-year old man present with a severe headache, photophobia, neck stiffness, Carnic sign is positive, midline lumbar puncture is done, determine CSF pathogen involved, perform procedure. There is first of the following structure to be pierced by lumbar puncture. So this is first structure. Supraspinous, interspinous, ligamentum flavum. Let's see the options. Interspinous. So posterior longitudinal is not there, anterior longitudinal. These now if you see, these are posterior longitudinal is after the spinal cord, anterior longitudinal it is in front of the, this is the vertebra, and you can see this is vertebra, body of the vertebra, and this is another vertebra. Anterior longitudinal is here, anterior part, posterior longitudinal is here, and there is spinal cord is like this, and from here there is ligamentum flavum. Then all this appears like this. This is supraspinous, intraspinous, then ligamentum flavum, then the layers: skin, subcutaneous, supraspinous, intraspinatus, ligamentum flavum. Then after ligamentum, dura is there. Then subdural space, arachnoid, subarachnoid. You have to go into subarachnoid space, below this space. 26-year woman present with a severe headache, photophobia, neck stiffness. Among other investigation, lumbar puncture is earned out and series of sand microscopy culture shows growth of Neisseria meningitis. The puncture is showing Neisseria meningitis. What is likely to be predominant cell type in CSF? So whenever there is infection, it is neutrophil. So it has to be acute infection, neutrophils. 70-year-old woman from the nursing home to the emergency department, abdominal pain, vomiting, dilated, abdomen is distended, 3 to 4 centimeter, 3 to 4 centimeter swelling, right groin which is non-tender and no cuff impulse. Femoral illness found. What is lies the medial border? Medial border is lacunar, medial, lateral, anterior, posterior. So medial is always lacunar, lateral is femoral vein, posterior is pectineal, anterior is inguinal. Anterior inguinal, posterior pectineal, medial lacunar, lateral is femoral vein. Separate the femoral canal. Now the other name for ligament of Cooper, pectineal is also called as Cooper, and lacunar is also called as Gibbermat's ligament, LG and PC. Next question is 26-year-old man presents to emergency department with extensive bleeding from his arm after sustaining glass injury. On examination, there is 7 centimeter transverse laceration across the anterior aspect of his elbow. On explaining, what do you expect brachial artery to be? So MBBR, median nerve, brachial artery, biceps tendon, radial nerve. Median nerve is medial, brachial artery is lateral. Brachial artery to be, what would expect brachial artery to be? Lateral to median nerve. 52-year man is a multiple myeloma. Skull appearance would be multiple myeloma, multiple osteolytic lesions. Osteolytic, just see, this is multiple myeloma, crab. So this is crab pictures of myeloma. N, multiple M, this is M, this picture is looking like M, myeloma carrying the N, multiple myeloma, pneumonic old crab. So old means old age. Okay, old crab, old age. Second is calcium is elevated. Third is renal failure, anemia, bony lytic lesions. So this is what is active myeloma, lytic lesions, spikes, bone marrow plasma cells, collapse vertebra, AL, amyloid, multiple myeloma. 50-year woman present with a history of right upper quadrant pain and jaundice. C reports that her urine was dark and stools are offensive. So this is upper quadrant pain, jaundice, obstructive jaundice. So fat is lost, either pancreatic malignancy or obstructive stones. Conjugated bilirubin is there. So what is the real conjugated bilirubin? Urine pale stool pruritus. 45-year-old man presents with backache, leg pain due to prolapsed lumbar disc, pain aggravated by cuffing, sneezing, radiate to lateral aspect of the foot, weakness of plantar flexors of the foot, which is the nerve root, the dorsiflexion and plantar is down, you stand on S1, this is the leg and you are just putting it down, this is S1, so plantar flexion is by S1, plantar flexion S1, dorsiflexion is L5, dorsiflexion of great toe, this is great toe, only great toe, this is L5, and foot above is L4, S1, L4, 5. So L4, 5 is there for great toe and dorsiflexion of foot, L3, 4. So L4 is the foot. 62-year-old woman present to general practitioner with 2-week history of back pain. She has got 8 centimeter, lost 8 centimeter height. What investigation reveal? So these are the investigations. Phosphate normal, calcium is increased, GFR normal, parathormone is increased. So both are increased. Calcium, parathormone, high, low, high. It can be primary parathyroidism. So this is excessive production of parathyroid, primary effect of parathyroid glands such as adenoma, and secondary it can be compensatory when is deficiency of calcium. So primary parathyroidism, parathormone, calcium, high, calcium is increased, phosphate is low. Why this is been doing wrong? Causes of hyperparathyroidism, it can be primary or secondary. 21-year man fractured with ulnar radius treated by means of plaster cast, which is removed 4 weeks after pathological process, is most likely to have affected immobilized muscle. When muscle is kept immobilized for longer time, it leads to atrophy. 22-year-old man with stabbed in the left intercostal space at the edge of sternum. This is right ventricle. Okay, this just important thing is that 22 years stabbed in the left intercostal at the edge of sternum, which structure is most likely to be penetrated. Oh, that's why this is right ventricle. Yes, not the left ventricle. This is not the sternum, this is the edge of sternum, so right ventricle, this is the edge of sternum, anywhere here it will be right ventricle, and mid clavicular, mid axillary line, there will be left ventricle. 80-year-old man dislocates his shoulder, introduced in emergency. At review 3 weeks later, he is unable to actively initiate the arm. Initiate abduction of the arm. Which muscle? Supraspinatus initiation, then deltoid 15 to 90, then trapezius and serratus anterior. Initiation by supraspinatus. 20-year-old boy is admitted for assessment of rectal blood loss. His mother describes this bright red blood in the pan. Age is 8 years, bright red, no pain. So it is juvenile polyp. 48-year-old woman presents with abdominal pain and 5 to 6 weeks episodes of 5 to 6 episodes of bloody diarrhea each day, complaints of pain in the knees, elbows, recent visual problems. So now there are multiple problems. Patient is having diarrhea, bloody diarrhea, abdominal pain, and other knees, joints. So what are the options here? Ulcerative colitis, it is associated with. So this is arthritis. And that's why knees and elbow can have primary sclerosing cholangitis, PSC, PSC, erythema nodosum, ankylosing spondylosis, pyoderma gangrenosum, multiple association with ulcerative colitis. 56-year-old man presents with acute epigastric pain, vomiting, guarding in the upper abdomen. Investigations reveal what is this? This is raised. Alkaline phosphate is normal. Albumin is normal. SGT is raised. Serum triglyceride is normal. Bilirubin is normal. Corrected calcium is also raised. Calcium is raised. So epigastric pain. Acute epigastric pain, vomiting, guarding upper abdomen. So corrected calcium. Now you have to think of what are the options. Let us see. Alcohol, choledocholitis, hyperparathyroidism. So calcium is raised, that's why hyperparathyroidism. Yes, 30-year-old man is admitted to intensive care unit with isolated severe head injury. CT scan shows multiple intracerebral bleeds, no midline shift, ventilated, pupils dilated, rate sluggish, heart rate is 50, BP is raised, so bradycardia is there, intra blood pressure is increased, and respiratory rate is 10. So this is Cushing's reflex, Cushing's stride. Rising BP is likely to be caused by raised intracranial tension. That is sympathetic stimulation related to intracranial pressure. So this is Cushing's stride. You have to understand this stride. Three things: raised BP, decrease heart rate, decrease respiratory rate. So this is because of sympathetic, this is because of parasympathetic. Systolic increase, pulse rate decrease, respiratory decrease. Symptoms of increased intracranial pressure. Intracranial pressure, this is also called as Cushing's reflex. Cause of bulbar ischemia, stimulates medullary cardio center, sympathetic outflow, bradycardia accompanied hypertension because of baroreceptor vagal stimulation. 42-year woman presents admitted to emergency department due to pelvic discomfort due to gynecologist. This is about uterine prolapse. What is that? Transverse perineal ligament. 80-year man, surgical transverse abdominal pain, pressure, BP is 100/60, pulse rate is 110. 80-year, age is 80 years. Central abdominal pain with a respiratory rate of 25 beats. He is known to have severe COPD is there. So in COPD, rigid abdomen, on examination, rigid abdomen, this is talking about perforation. So it has to be metabolic acidosis. Actually in COPD also there is respiratory acidosis, it's compensatory. So findings is not, this is acidosis. pH is decreased, means acidosis. PCO2, it's normal. Bicarbonate is decreased, so it is metabolic. This is peritonitis, metabolic acidosis. In describing SA node, which one of the following statement is correct? SA node. It is a part of somatic, usually supplied to coronary wall and right ventricle. It receives nerve supply from the vagus plexus. Fibers from the nervous vagus. So this is SA node. It is getting nerve supply from the vagus parasympathetic. So this is parasympathetic, and sympathetic is also coming from the medulla T1, T2, T3, T4, T5. This is also sympathetic. Cardio inhibitory center, medulla. Cardio acceleratory is sympathetic. There is one cardio inhibitory. Vagus stimulation causes decreased heart rate. Sympathetic stimulation causes increased heart rate. 21-year fit old man is admitted with acute abdomen, subsequently diagnosed with gastroenteritis. A part of the host immune system, which of the following immunoglobulin cells are correctly paired? Host immune. Now IgA correctly paired. It's not macrophage. IgD, small bowel. A is epithelium. E is endothelium. No, it is with allergy. IgG, plasma cell. So this is with the plasma cell, IgM thymocyte. 45-year-old man present with a fever and pain in the right groin and soft swelling noted in the femoral triangle. Diagnosis psoas abscess. Which of the following statements is accurate regarding psoas major? It arises from T bodies of the spinal T12 to L5 and inserts on the lesser trochanter. So this is T12 to L5, psoas major, psoas minor, and inserts. Which of the following muscle is extensors of the hip? The basic is gluteus maximus. Now what are the other muscles? Semitendinosus. So if you see extension of the hip, this is the extension, gluteus maximus, and hamstring, semitendinosus, membranosus, bicep femoris. So here it was semitendinosus. Adductor longus is the medial rotator, gracialis, and all these are on the. And this is a small medial. Iliopsoas is the flexor. Pectineus is again. Pectineus is flexion. A tall 25-year-old woman present with surgical complaining of swelling in front of the neck. Front of the neck lasts for 4 months. Clinical swelling in the left lobe of the thyroid. Multiple neuro. So this is tall with multiple neuromatous lesions in the oral cavity. Blood pressure, pheochromocytoma, thyroid swelling. Then laboratory shows WMA. What of the following most likely to be cause of hypertension is pheochromocytoma. So this one is talking about MEN 1, 2, 3. So here it is pituitary adenoma in 1, parathyroid hyperplasia, pancreatic tumor. And second MEN 2A and 2B, there is parathyroid hyperplasia, medullary thyroid carcinoma, and pheochromocytoma. In additional morphocyte, tall is morphocyte, and all this. And what is the other thing? Multiple neuromas. This is mucosal neuromas additional to medullary thyroid, pheochromocytoma, and morphocyte. So clinical diagnosis of pheochromocytoma is based on urinary metanephrines or Vinin-Mandelic acids. Localization is by MIBG scan. Functioning is FDG PET scan. 65-year man present with hematuria left loin pain, CT demonstrate left renal tumor, left radical nephrectomy. Where does left renal artery lie? So artery is behind the vein. So what is the question? Let us see. It is behind the vein. Within the posterior triangle, which nerve would risk of damage during surgery? Posterior triangle, most of the common accessory nerve, spinal accessory is commonest nerve. So this is the spinal accessory nerve supplying to sternocleidomastoid. This is arising like this, sternocleidomastoid going to trapezius. So that's why any injury is there, this muscle is supply is lost and this is prevented. Most of the time it is crossing from anterior to behind. And this hypoglossal nerve, 12th nerve is crossing from here to here. Right and left pulmonary arteries are derived from which of the following? To get this right and left pulmonary arteries arise from sixth arch. So the questions of developmental arches. So incus malleus 1, stapes 2, and nervis. This is V1 maxillary, facial, glossopharyngeal, vagus. So this is muscles of mastication. Artery is maxillary, here is stapedial. Bone is stapedial. Common carotid here, subclavian arch, stapedial artery. This is right and left arch, sixth pharyngeal arch. Right pulmonary, left pulmonary, ductus arteriosus. Even ductus arteriosus is also from sixth arch. Aortic arch, right aortic arch, subclavian artery. Right and left pulmonary artery. Right and left pulmonary artery. Aortic arch is from the fourth. Aortic arch from the fourth. 47-year-old man present to emergency department 6 hours after climbing accidentally initially assessed suggests that he has lost 1 liter of blood. His blood pressure is 105, pulse rate. He is catheterized and blood contains 120 ml. Activation of which of the transport system best describes how aldosterone leads to maintenance of intravascular system? So this is renin, angiotensin, aldosterone system. So now this is important question. So how is this? This is the glomerulus filtration, soda bicarb, carbonic anhydrous, then loop diuretics. This is osmotic water is absorbed here, and this is concentrated here. Then again solutes are absorbed here. When it goes out, solutes are absorbed. Now distal convertible sodium is absorbed. Thiazide is acting here, potassium sparing is here. Sodium, potassium in collecting duct. So this is the action of aldosterone. This is the action, aldosterone. Sodium, potassium in collecting duct. Aldosterone is at the level of collecting duct. So ascending loop, furosemide, distal is thiazide, collecting is spironolactone. Percentage of sodium filtered, this is also question. So 25%, if furosemide is given, 25% of sodium is excreted out. If you give furosemide, diuretic. If distal convoluted tubule thiazide is given, sodium percentage is 3 to 5%, and in collecting sodium percentage lost will be. So whenever furosemide, in that most of the sodium is lost. During arch audiography, vertebral is seen arise from direct lobe. Which of the following? It is a branch of subclavian artery. First branch of subclavian with CD, vertebral, intermammary, costocervical trunk. A 65-year-old man remains on high dependency unit following gastrectomy. 3 days pre-operatively, his urine output at average 80 ml per hour for last 24 hours. He has one dry abdominal drain, no gastric tube, urea and electrolytes normal. He is to stay nil by mouth for 24 hours. Which of the following regime is most appropriate to his electrolyte and water requirement over next 24 hours? So patient is 65 years. This patient needs more IV fluids. Urine output has average 80 ml per hour. It's okay. Less than 35 means it's very low. So he has got normal. So this patient needs normal saline, 1 liter normal saline, 1.5 liters, 5% dextrose. This is the normal maintenance. First 24 hours orders 2 liter 5% dextrose or 1.5 liter 5% dextrose, 500 isotonic saline. So 500 isotonic saline is also enough in the first 24 hours because sodium less is required. Second, you need 100 ml. Here you increase 2 liters dextrose, here 2 liter dextrose plus 1 liter saline. Second day you increase maintenance fluid. Third day 40 to 60 milligram potassium per day. Maintenance fluid should be administered at a steady rate of 18 to 14 24 hours period. So 40 to 60 means 20 on each point. So 3 liters, each liter has to be 20 milliequivalents potassium has to be put. 3-year boy is admitted to the hospital with severe vomiting. Radiological exam reveals suffering from annular pancreas. Which of the structure is constricted? Second part of the duodenum. So the weeks, if you see what is the weeks, it's not given here. 25 weeks. 20-year old woman with severe head injury being ventilated using intermittent positive pressure ventilation. Which of the following sequences occurs? Whenever positive intrathoracic pressure increases, that decreases the venous return. So that is cardiac preload is decreased. 36-year-old man present with 2 months history of low back pain radiating to the left leg after clinical examination is referred to MRI and shows prolapsed disc, which the sign are consistent with S1 roots. Which of the combination of clinical signs? So S1 is there, so plantar flexion will be weak. Altered sensation of the sole, loss of ankle jerk. So all these about the S1. 55-year-old woman undergoes cholecystectomy, gallbladder contains multiple dark irregular stone. What most likely be the type of stone? Pigmented stones, conjugated bilirubin. Cholesterol is brown, pigmented and mixed. Pure cholesterol, solitary, pure pigment, bile cell pigment are two types, black and brown. Brown is associated with cholangitis and biliary parasites, and black with hemolytic diseases. Black, if it is with the hemolytic diseases. Unconjugated bilirubin. 55-year-old man present with deep vein thrombosis. Blood count shows hemoglobin is thrombocytosis, erythrocytosis. So this patient is having renal cell carcinoma or something like that. Erythropoietin is increased, that's why it to increase. 27-year-old has a pancolitis last 5 years. Which one of the following complication least likely to develop? Polyarthritis. This question is again coming. Polyarthritis is not a part of ulcerative colitis. P. fenestrel incision, it is related with the past transversal dysphagia. 25 splenectomy, the 3 days after splenectomy there will develop post-operative venous blood will be increased platelet count. Thrombocytosis. 46-year woman is present in pre-admission clinics. She has myocardial infarction 2 years ago. Examination atrial fibrillation. Recent echocardiogram shows she has dilated left ventricle. She is on warfarin 6.1. Warfarin inhibits which of the vitamin K dependent factors? So warfarin inhibits prothrombin. So this is important. 2, 7, 9, 10. The 2 is prothrombin. So warfarin 1972. So this 2 is called as prothrombin. That's why you have to remember this. Prothrombin is 2. And heparin, dabigatran. This is also called as heparin. This is heparin antithrombin. Prothrombin is converted to thrombin 2A. Warfarin inhibits K factor 2. Warfarin 1972 and CNS extrinsic pathway. Prothrombin time, oral, slow onset, crosses placenta. Heparin does not cross. Prothrombin is reversal. So this is thrombin 2A dabigatran. 75-year-old man is admitted to the electro repair of abdominal aortic injury. Following the operation, this systolic blood pressure falls 90 mm during resection. Given IV fluid, choice of colloid crystal. Which of the following basic intensive therapy decide to administer a colloid? Choice. Decides to administer a colloid. Colloids are not freely across the. Why intensive decides to administer a colloid? There is a choice of colloid or crystal. Which of the following best describes why intensive therapy unit decides to administer colloid decrease transcameral colloids? Colloids are not freely filterable across the semi-permeable membrane. So it is not transferred, that's why it remains, but the side effects are more, that's why crystalloids are preferred. 35-year man, septicemia, following surgery for perforated acute appendicitis. He is hypotensive. Arterial blood gas reveals septicemia, perforated appendicitis. Metabolic acidosis has to be there. Acidosis is there. Immediately go for this. Metabolic acidosis. If it is compensated, then the CO2 should come down. But this is clear cut. Respiratory is also there. It is not compensated, so it is mixed. Respiratory PA2, PO2 also there. 20-year man presents to the emergency department with a stab injury to the thenar eminence. He is found to have 2 centimeter long laceration, loss of sensation in the thumb and the index finger, and weakness of thenar muscles. Which of the following structure is most likely to be injured? So nerve is sensory and motor branches of median nerve. 65-year man presents with the examination. He had 3 palpable epigastric mass. He had 3 centimeter epigastric mass. Transpalpal plane lies at which vertebral level? It is not about mass, it is about L1. Passes through the 9th costal cartilage on both sides. It is level of first lumbar L1, pylorus of the stomach, DJ flexure, neck of the pancreas, hyla of the kidney. Subcostal 2 lines, intercrestal plane. This is the crest. It is L4. This is intercrestal. This intertubercular. This is tubercles. Joint tubercles of the iliac crest. L5. 30-year motorcycle is brought to emergency after road traffic accident. Open fracture right femur, arrival tachypneic, confused and cold, clammy skin. Physiological changes are most likely to occur. So physiological changes, he is in shock, that's why. Okay, serum bicarbonate levels, decrease reabsorption of water from this will be increase. Everything is will be increase in pH. No, pH will decrease. Acidosis will be there. Decrease serum bicarbonate level. So acidosis is there, so bicarbonate will be decreased. Increase secretion of sodium in the urine. That will be retained. ADH will be secreted. Increase. In emergency situation, what is the most appropriate surgical method of obtaining airway? Cricothyroidectomy. Cricothyroid membrane. 75-year man present with a hepatomegaly and ascites, computed stomach ratio, evidence of post-hepatic portal hypertension. Post-hepatic. The inferior vena cava passes to the diaphragm at what level? VOA. So inferior vena cava 8. 20-year man present acutely with abdominal pain. Imaging reveals right over incised area of fat, muscle, thyroid. This is teratoma. 25 woman who is 2 months postpartum, tender mass in the left breast, postpartum, after delivery, 2 months, fever is there, seizure increase, lactation mastitis, abscess. A diagnosis of mastitis. Which of the following are most likely causative organisms? Staph aureus. Alcoholic man admitted with pancreatitis. 3 days after admission, he becomes hypoxic, confused, chest X-ray, uniform opacity, both lungs. Which of the following most likely diagnosis? Alcoholic, pancreatitis, hypoxic, chest X-ray, uniform opacity is ARDS. A 58-year woman present to the emergency department with large fluctuant swelling in the site of insect bite, anxious, tachycardic, ECG shows critical fibrillation. She is noted to have a goiter. Swelling at the site of bite requires surgical drainage. Which of the following class of drug would be most appropriate as a part of preoperative preparation? So this is age is 58, swelling, anxious, tachycardia and pyrexia, ECG fibrillation, goiter is there. So this patient is having Graves or something like that. So drugs both are beta blocker and alpha blocker, antithyroid as well as beta blocker, thienamides, beta adreno blocker. Only question is one, beta blocker is required. Beta blocker and thienamides, actually both the drugs are required. Mainstay of the therapy and effective control manifestation of hyperthyroidism. Long-acting agents preferred. Target heart rate is 80. Block synthesis thiamine hormone. Methimazole, carbimazole. Propylthiouracil is used during pregnancy. PTU is used. Nulliparous 30 years woman presents with recurrent painful area in the areola. Nulliparous, painful, smoking cigarette, mastitis. So, okay, subareolar abscess, micro do not grow any organisms. The lesion is X-ray histology shows squamous metaplasia of lactiferous duct. So there is metaplasma minor does not grow any organ. Which of the following is most likely diagnosing? Lesion is X-ray histology squamous metaplasia. Central perioral, most young woman, uniform perirectal mastitis. Current evidence suggesting that smoke is important etiology of non-lactation substance in the cigarette, whether damage the tissue becomes aerobic and anaerobic. So that is non-lactation mastitis. 65-year man undergoes right hemicolectomy on second post-operative day. Febrile nausea, distended abdomen. He is intravenous morphine. Patient control and patient distended loops of small intestine. Physiological paralytic ileus involves stimulation of morphine is having mu receptors. Constipation is one of the cause. It subsides the motility. 42-year-old woman with cholecystectomy develops self-limiting post-operative infection by what process? Bacterial ingestion. This is opsonization. 60-year-old non-smoker, 3-month history, weight loss, examinations, left supraclavicular lymph node, chest reveals multiple bilateral opacities. Which abnormality would biopsy of left supraclavicular lymph node probably show? So this is malignancy, mitosis and all that. Multiple abnormal mitotic figures. So microscopic features of anaplasia. This is pleomorphism, hypochromatic nuclei, multiple large nuclei. So this is about the malignancy. 78-year woman with emphysema receiving 28% oxygen has following blood gas results. Most likely interpretation. There is acidosis and CO2 is raised. Bicarbonates very heavy. So metabolic compensation is there. COPD, emphysema means respiratory acidosis with metabolic uncompensated respiratory acidosis with uncompensated alkalosis. Partially compensated respiratory acidosis. Oh, it cannot be called as uncompensated respiratory acidosis because this is partially compensated. This partially compensated or uncompensated respiratory acidosis, both are same. Two-year-old child is referred to because of impalpable test in the scrotum. Which of the following positive describes the ectopic testis? This is ectopic. The position has to be different from the normal path at the root of penis. 60-year-old man is found to have 2 cm diameter in the upper lobe of the left lung and lesion is excised. It is found that lesion includes connective tissue, mature cartilage, and this is hamartoma in the lung, like teratoma in the ovary. Yellow granules is actinomyces. Old man, mesentery, angiography, and no symptoms of ischemia. Which one of the following arteries is most likely to be source of blood supply territory of inferior mesenteric artery? So inferior mesenteric artery supplying to the left descending colon. What is this? Inferior mesenteric artery, but no symptoms. So middle colic is supplying to the region of inferior mesenteric artery. Intravenous drug abuse having echocardial suspected endocardial closure of tricuspid valve occurs at the onset of which phase of cardiac cycle? So cardiac cycle, AC, asymmetric contraction. If you see JVP, ACV, so tricuspid also closes at X. Tricuspid wall moves downward. C wall closed tricuspid. C is closure. A is atrial contraction. C is closure of tricuspid. X it moves. Tricuspid wall moves down. V is venous filling. Y is emptying. After being stabbed in the left groin, previously the 20-year man was admitted to emergency department. He developed hemorrhagic shock during his 10 units of own irrigated blood. 24 later, he noted a severe dyspnea of which required intubation, ventilation. Which of the following most likely to be the cause of respiratory insufficiency? So stabbing is there, adult respiratory distress syndrome. Pulmonary, non-pulmonary. Pulmonary aspiration, vasculitis, contusion. Non-pulmonary is sepsis, trauma, trali, cardiogenic, non-cardiogenic shock. TURP is done, surgery is prolonged. This is TURP syndrome, hyponatremia. Cerebropontine angle, nerve 7 and 8. So first two nerves from the cerebral hemisphere, midbrain has got two nerves, pons 4 nerves, medulla 4 nerves. 5 to 8 is from the pons, 9 to 12 is from medulla. After resection of rectal tumor, a patient experiences erectile dysfunction, pelvic splanchnic, parasympathetic and sympathetic. T12L1 is parasympathetic S2, S4. So index, middle and ring finger in both hands show ulnar deviation. Ulnar deviation, so this is medial nerve area. Let us see rheumatoid arthritis. Okay, this is not about nerve. Index, middle ring finger is ulnar deviation. This is rheumatoid, specifically ulnar swan deformity of the thumb, ulnar deviation. Index, middle and ring fingers in both hands, ulnar deviation is rheumatoid arthritis. 22-year-old man arrives images sudden breathlessness due to large pneumothorax. A chest drain is inserted in the 5th intercostal space. In 5th mid-axial line, there is hemorrhage in the drain bottle, most likely to cause of hemorrhage, intercostal arteries. Pulmonary embolism. Which of the ECGgram shows support this diagnosis? Pulmonary embolism. So right ventricular strain and right bundle branch power, T-wave inversion V1 to V3. T-wave inversion in V1 to V3. This V1 to V3. T-wave has gone down. S1 Q3 T3 QR pattern in V1. Inversion of T in V1 to V3. This is important. S wave in lead 1. 40-year-old woman had an anterior lobe of pituitary tumor because of tumor without post-operative supplement. Which of the following could occur? Anterior pituitary tumor is increased. So there is hyperpituitarism that will lead to increased cortisol. Without post-operative supplementation, which of the following could occur? So if it is removed, thyroid has to be supplemented. So these are the important hormones released from pituitary, anterior and posterior pituitary. Target FSH, LH, TSH thyroid. This is testis ovary. This is thyroid. ACS cortex, prolactin mammary, MSH. So, and this is posterior pituitary. This hormone is ADH, kidney tubules, oxytocin, mammary glands, and uterine muscles. So next question is 38-year-old man in end-stage renal failure resulting from polycystic kidney Diffuse characteristic cadaveric renal transplant. Good renal function established, but 4 weeks later deteriorates. Serum creatinine is rising. Which of the following process is the most likely to be responsible? Now, whether it is infection or rejection, now it can be 4 weeks means acute rejection can be there, and that is T cell mediated. This is important. This chart is very important. Hyperacute is immediate. This is preformed antibodies directed against donor tissue, ABO, or it can be type 2 hypersensitivity. So this can be antibody antigen reaction or cell mediated. That is the thing. So acute, weeks to months, this is T cell mediated. Here can be cascade, complement can be there. Complement, a word complement is there. This is also here. And acute, weeks to month, it is type 4 hypersensitivity. Months to year, chronic T cell mediated, looking like, and graft versus host is again type 4, donor T cells. So this is immunocompromised host. Most commonly bone marrow transplant patient with diarrhea, rash and jaundice. T cell mediated is acute. T cell mediated, this is important. Hyperacute is preformed antibodies. This is the difference. In order to expose right axillary artery, this is common question. Right axillary artery, if you want to expose, which delta factor, which structure is encountered in the dissection due to vessel, thoracoacromial artery, and which is not is the joint capsule. 4-year boy present emergency, 2-day history of headache, vomiting and drowsiness. CT scan, dilated ventricles, both of his lateral ventricles and third ventricle, cerebral aqueduct. 12-year boy, the helping is cut the grass, develops itchy. This is allergy, which is type of which hemoglobin? Allergy is E. Type 1, acid, egg. 35-year-old woman goes gastric bypass for morbid obesity, subsequent surgical need, dizziness, hypoglycemia. This is dumping syndrome. Palpitation, which is most likely explanation of symptom. So release of insulin. So suddenly this is rapid dumping, 30 minutes, early dumping, late dumping after 2 meals. So insulin is released. That is the thing. 56-year-old man with chronic emphysema and high dependency unit, 10 days after anterior resection developed shortness of breath and hypotension. Which of the following landmark will be appropriate to obtain femoral? This is about femoral blood gas, mid-inguinal point. So it is midpoint between anterior supracerebellar spine and 70-year man complains of persistent numbness in the inguinal hernia. After inguinal hernia, it is ilioinguinal nerve. So if you see this chart, don't get confused. The question only common and again coming is with ilioinguinal only. This ilioinguinal. This is ilioinguinal. This is ilioinguinal. This is only we have to think of. So this is coming like this. One part is going medial side of the thigh and another branch is going here. So questions is asked on this. And genital femoral nerve, scrotum, and it is on the middle side of thigh, but it's not asked. So 12-year girl has diastolic murmur, maximum audible in the second left intercostal. Second left is pulmonary, right is aortic. So second left pulmonary, right aortic, tricuspid on the right and mitral on the left. Again, this is aortic, this is pulmonary above, and near the apex it is mitral, and here by the side of sternum is tricuspid. This picture is important, where you are seeing heart sounds, murmurs. 34-year pregnant patient swollen. Her mother maternal also has similar program in pregnancy. This is antiphospholipid. So this is what I was thinking. What is antiphospholipid syndrome? Recurrent arterial venous thrombosis and pregnancy morbidity with persistent anticardiolipin antibodies or lupus anticoagulants. Antiphospholipid serum. Major types of antiphospholipid antibodies: false positive serologic test for syphilis, lupus anticoagulant positive 30%, anticardiolipin antibody. This is anticardiolipin antibody. Fight flight response is adrenaline. This causes glycolysis. So there is no gluconeogenesis or glucolysis actually. Increase heart rate, glycogen breakdown, increase glucose. So glycolysis, breakdown of glycogen. Emergency appendectomy. Which of the following physiological parameters are consistent with sepsis? Sepsis, SVR is low, cardiac output is low, heart rate is increased. So cardiac output, SVR is low. This is important. Cardiac output may increase compensatory. This is septic shock. Central venous pressure, systemic vascular resistance, CVP. So cardiac output will be increased because of increased heart rate. Tachycardia is there. 50-year-old man, 30 years history of pancolitis. Under surveillance colonoscopy revealed plaque-like lesion in the distal. Biopsy revealed pre-malignant lesion. What is the name of pre-malignant? Pre-malignant is dysplasia. Metaplasia is the displacement of one differentiation to another and type in not normal in metaplasia of persistent dysplasia condition, abnormal cells that lead to enlarged tissue and precancerous cells. 60-year man undergoes cystectomy of the bladder during surgery. Ureter's artery, which of the portion ureter posteriorly opens? 8-year-old, a year-old patient in ICU in tracheostomy performed in second and third, fourth stage. Which intervention stage is most likely to require transection? This is isthmus. 23-year man is assaulted with sustained stabbing injury to the left groin and wound is clean and simple dressing is applied. 6 months later, patient returns with pulsatile swelling at the site of injury. So this is saphenous varix or false aneurysm can be there because of groin injury. 72-year man with body mass index 18.5 not eaten for 4 days and following removal of the adenocarcinoma of distal colon, urea is found to be 12 and blood gas is ordered and most likely set of results are of metabolic acidosis. So 7.3 bicarbonates are low, PCO2 is low, so acidosis with compensatory. So what is the question? Okay. What is the picture of metabolic acidosis? Acidosis has to be there and bicarbonate has to be low. So these three has got acidosis and here the bicarbonate is more. So you have to just think of this and this. A 16-year-old boy is hit on the left side of the base and broken bones, but boy complains of numbness of face below the eye, infraorbital. What is the answer? Yes, supratrochlear, infraorbital, mental, trigeminal, branches of trigeminal. 74-year who has undergone emergency major abdominal 2 days previously noted to be confused and furosemide for the mild heart failure. The plasma sodium is 122 chart. What is most likely cause of hyponatremia? Overgiving of the IV fluid, not less than sodium-free fluids. So this is another picture. What is this? Loop diuretics acting here. Sodium, potassium chloride is absorbed here and glucose is absorbed initially in proximal convoluted tubule, distal convoluted tubule, again thiazide diuretic and it is aldosterone. Cori cycle elemental is which of the following relies on the Cori cycle? It is erythrocytes. So what is Cori cycle? So liver what happen and muscle what happen? Glucose is converted to pyruvate and lactate and muscle. So it goes into the blood, lactate is converted to pyruvate and ATP is required. Lactate is formed in muscles or RBCs. So this is the anaerobic cycle. Cori cycle operates during exercise, and lactate is reutilized by the body in the liver. Liver cell LDH converts lactate to pyruvate. Pyruvate enters general into form glucose. After receiving intramuscular injection, Buttock 20 complains of inability to evert the food. So lateral, there is a common peroneal, superficial peroneal branch of the sciatic nerve, component of sciatic nerve. So this is the lateral component, everters. This is the anterior muscle deep. 73-year man, history of irregular bowel movements, and present with this dysuria, nematuria, E. coli, UTI present. Nematuria, there is diverticular disease. So there is fistula, colonic diverticular disease. 7-year-old women recovery area 20% oxygen. ABG shows acidosis. This is increased carbon, respiratory acidosis. So central cells are not responding. 76-year-old woman sustains an intratrochanteric fracture. ECG shows low voltage complexes, PQ internal coins. So there is prolonged QT is calcium, hypocalcemia. With the following learned best explanation of the clinical picture. Low voltage complexes and prolonged QT intervals. So ECG shows hypothyroidism and bradycardia, low voltage complex, ST segment depression, QT is lengthening and increased dispersion, flattening of the Q. So why not parathyroid? Okay, thyroid, hypothyroidism can also lead low voltage. 36-year man falls on outstage hand, examination tenderness in the anatomical snub box. Which one of the following forms the boundary of anatomical snub box? So extensor pollicis longus form the posterior medial body. Abductor pollicis longus, extensor pollicis brevis. Abductor pollicis brevis is not there. A 65-year-old woman with metastatic breast admitted to the hospital, confused, unwell, nausea, vomiting, vital signs, anemia. What is abnormality? Hypercalcemia, malignancy is there. That's why there is hypercalcemia. So 4-year boy, fever, chills, temperature 39, WBC raised, CRP raised, unable to weight bear. So this is septic arthritis. 35-year-old woman with recurrent peptic ulceration. She is on proton pump inhibitors and previously received helicobacter and 3 months ago. Which of the following is likely to raise in venous blood? So gastrin hormone is very much raised. Gastrinoma. 55-year-old man presents with backache, neurological with lack of extension of the great toe. Great toe flexion and extension. It is L5. So L5, wherever it is there, you have to measure. It is L5. 34-year man is seen emergency department with fibroid fracture, knowing football match. He has loss of foot eversion. Which area of the skin should be examined to confirm this? Dorsum of the foot, eversion, lateral superficial peroneal nerve, dorsal surface of the foot. 68-year-old man with insulin dependent diabetes mellitus, pre-admission clinic prior to surgery for rectal creatinine is found to be here referred to the renal unit. GFR is done. Which one of the following is best describes why inulin? It is neither secreted nor absorbed, nor it is filtered, nor secreted nor absorbed. GFR is equal to ml, which is divided by P, V divided by P. P is equal to V into U. And what is V? Inulin excreted and rate of urine formation. Calculation of GFR, this has to be given. So urea, renal blood, paraminopenicity is creatinine. 60-year-old man present with a 1-month history of headache, confusion, and recent onset of right side hemiparesis. CT demonstrate 4 cm by 4 cm lesion with central necrosis of frontal lobe. It is extending across the midline along the corpus callosum. Extensive edema around the lesion. Which of the following is most likely diagnosis of the lesion? Central necrosis, it can be in the frontal lobe, glio. This is glioblastoma. "65-year-old man presents with 2.5 mass in the outer quadrant of the breast with associated axillary lymphadenopathy, core biopsy taken, which confirms presence of carcinoma. Which of the following types of carcinoma? Mostly globular ductal carcinoma. Invasive ductal carcinoma. Infiltrating duct carcinoma, IDC. Most common is IDC. 26-year-old man is admitted to the emergency department with multiple peripheral fractures. He is clinically shocked. What structure responsible? First hemostatic response to fall in. First hemostatic response to a fall in systemic blood pressure. Baroreceptors. Vitamin K is required normal. Which one of the following statement is true about effect that availability of vitamin K? Absorb affected by resection of terminal ileum. Important. Terminal ileum. Septic shock, epinephrine, increased systemic vascular resistance action result of stimulation of alpha 1 receptors on the vessels. Ten-year child present with progressive facial weakness, squint and examination. There is lower motor facial and failure of abduction of one eye, abduction. One eye, lateral rotation. MRI shows small intrinsic muscle lesion which central nervous system. Where is the most likely to be located? So lateral rectus cannot be then. Lower motor facial weakness. So facial weakness means muscles of facial expression is also involved. Facial nerve is also there in sixth. And so what are the options? Pons. So that's why midbrain, pons, medulla. Pons, the nerve is. These are the two nerves. Facial nerve. That's why two nerves are involved. 65-year-old woman with a history of ischemic heart disease and abdominal perineal excision of rectum, which is stable. 2 days later, clammy, cold, periphery, tachycardia, blood pressure 80/60, temperature is normal. So this can be ischemic heart disease. So cardiogenic shock. Already ischemic heart disease explained. 55-year-old man present to GP with 4 history of feeling tired. General practitioner notes breast enlargement reveals. Man is there, 55-year-old man. Notes breast enlargement reveals TSH is low and T3 is normal. Which of the following? Primary basic, secondary hypothyroidism. This is secondary. 40-year-old woman present with a parotid tumor. Biopsy reveals extensive perineural veins adenocystic carcinoma. 50 present with malaise, abdominal pain, fever, malaise, polyarthritis nodes are noted with all of the following except polyarthritis nodosa. 30-year-old woman undergoes subtotal thyroidectomy. 5 days later, wound appears red and inflamed. Subtotal thyroidectomy, wound is there. 5 days later, which of the causative staph? 50-year-old man complains of recent onset diplopia. On examination, unable to look inward and downward with the right eye. What is most likely lesion? SO4. 157-year-old transplant heart. 57-year-old heart transplant recipient is keen to join a cardiac rehabilitation. Which of the following factor most likely to increase cardiac output? Atrial failing, increase atrial failing. 69-year man with rectal cancer undergoes low anterior resection. Liver is disease-free. Pathology of the tumor reported. Large tumor invading the carcinoma. 2 nodes in 24 hours. Large tumor invading from carcinoma into mesorectum. Tumor is completely excised. This is correct pathological staging. What is Duke's? So 2 nodes. So it is Duke A, B, C. C is there because it is no metastasis. Lymph nodes are involved. 21-year-old man is admitted to the department with stab injury to the right chest. Pulse is this normal, BP is low, pulse is increased, BP is low, X-ray shows hemothorax, large hemothorax, very small apical pneumothorax, which is the first substance secreted in response leading to increased renal absorption of sodium in response to injury. Renin 20 during second proliferative phase of wound healing, predominant cells in the sites of fibroblast. The cell is mesenchymal origin and produce matrix and collagen. Cross linkage of collagen requires hydroxyproline and hydroxyl residues, which requires special vitamin C. 62-year-old woman presents to firm irregular mass in the right upper outer quadrant of right breast, appears malignant on mammography. The fine needle aspiration cytology is reported carcinoma. First lymph node to which tumor is most likely to metastasize, anterior axillary group. Now you see vitamin A, vision, B1, beriberi, C is scurvy, D rickets, D calcium, iodine catheter. First lymph node sentinel, and it is if which of the following statements are true relation to the cardiac muscle? Contraction is triggered by the calcium influx. Calcium is important for cardiac muscle. 70-year-old retired worker from the scaly lesion on the back of the left wrist, biopsy is enlarged pleomorphic squamous carcinoma. Mitosis has breached the basement membrane. Name of the process is carcinoma, squamous cell carcinoma. This is neoplasia. Hypertrophy size, hyperplasia number, metaplasia number, change in one to another. Dysplasia is disordered. Neoplasia is clear-cut malignancy. Uncontrolled and irreversible is neoplasia. And dysplasia, metaplasia, dysplasia. 145-year man is established cirrhosis and follow-up appointment is palpable. Spleen 4 finger breadth below the costal margin. Full count has shown persistent thrombocytopenia. Bone marrow show megakaryocytes. What is most likely cause of thrombocytopenia? Inefficient production, platelet destruction, sequestration. Platelet destruction in spleen, platelet destruction or sequestration, both are like same. Surgeon is carrying out elective splenectomy for congenital spherosity. Which structure will be divided? Lienorenal ligament. 50-year-old man admitted with epigastric pain, rigid abdomen, diagnosed to perforated duodenal ulceration due to excessive gastric activity may be caused by increased level of histamine or adrenaline. Adrenaline can increase. Option is not histamine, that's why adrenaline can increase. 66-year-old woman with known tumor of her spine and started to retain urine and is experiencing decrease in renal rectal tone. Tumor is spreading directly to the conus medulla. Which one of the following vertebral level is tumor is likely to be located at? S234 pudendal nerve is supplying to the external sphincter. So let us see. Okay, this is conus medullaris. So below that all will be involved. Lower limit of spinal cord in fetus, conus medullaris, S2 at birth, L3 adults, L1 2. So tumor is at conus medullaris. So L1 2. 26-year man brought to emergency 2 months history of unilateral testicular swelling, ultrasound so heterogeneous mass. This is teratoma. Alpha fetoprotein is Ingraj, it is teratoma. Classic efficient seminoma is 40%, age is little bit, teratoma is lesser age, seminoma is middle age. 50-year-old woman present with history of fecal incontinence over there. She has prolonged labor and physical examination will lacks anal swelling, which likely led to pudendal nerve. So myoglobin, very dark brown urine, and what is abnormal renal function? Rhabdomyolysis, myoglobin. 86-year-old woman with a history of partial gastrectomy. Is high dependency unit for chest infection. She is complained of difficulty in swallowing, endoscopy with multiple white patches on the mucosal surfaces. 86 patches, whether it is fungal and candidiasis. 65-year-old woman is total of 15 milligram of morphine and 30-minute period, pain relief, fracture neck femur, observation found, SpO2 80, BP 66, breaths very low, immediate intervention required. You have to reverse this morphine by tracheal intubation. So this patient is having respiratory depression severe. So what are the antidotes? Acetaminophen, acetylcysteine, anticholinergic neostigmine, benzodiazepine, flumazenil, calcium channel, calcium chloride, cyanide, digoxin, heparin, protamine sulfate, iron, insulin, glucagon, lead, EDTA, opioids, naloxone. This is what I was thinking, naloxone for morphine, warfarin, vitamin K. Following drugs are used to treat patients with peripheral vascular resistance. They all reduce the rate of myocardial infarction and stroke except oxypentaphyline. Pentaphyline belongs to the class of group known as hemorrhagic logic agent. It works by helping blood flow more easily through narrowed arteries. This increases the amount of oxygen that can be delivered to blood, and when muscle needs more. So oxypentaphyline does not decrease the risk of myocardial infarction. Peripheral artery disease, all these have to be, antiplatelets has to be given, aspirin has to be given, clopidogrel has to be given, the walking has to be there. 4-year boy brought to emergency with painful right elbow, and father said he was swinging his arms. And what is ligament? Annular ligament. 35-year-old woman, 3 weeks history of low back pain, 3 days history of pain, weakness, physical exam demonstrated numbness over the posterior aspect of the left calf to lateral aspect of the foot. This is sural nerve, nucleus pulposus. Okay.